In this video, we will walk through the proper way to safely administer an IV bolus of a chemotherapy drug. Examples of chemotherapy drugs that are given as an IV bolus are listed here. First, gather all the supplies needed for chemotherapy administration. Some of these items were sent previously by VOP, including the bags of personal protective equipment, saline flush and administration supplies pictured here, and the chemotherapy drug itself, which was stored in your hospital's refrigerator when the shipment first arrived. You will also need a 3 ml saline flush syringe, which should be readily available within your hospital. You are now ready to don your personal protective equipment. All team members that will be participating in the chemotherapy administration need to put on a provided chemotherapy mask, gown, and nitrile gloves. Each team member will need to double glove prior to chemotherapy administration. Safety goggles or a face shield are also recommended but not provided by VOP. It is important that the sleeves of the gown extend to cover the end of the gloves and any exposed skin. Now it's time to place your patient's IV catheter. We strongly recommend watching the VOP training video on proper IV catheter placement for chemotherapy administration. Once the catheter is in place, you will need to remove the chemotherapy dose from the chemotherapy transport bag and confirm with the doctor that the patient label on the drug matches the drug name and dose listed in the VOP consult. A copy of this consult was included in your patient document sleeve shipped with this dose, as well as sent via email to your hospital. If the IV catheter was not placed immediately prior to chemotherapy administration, then we recommend that placement be confirmed one more time. The IV catheter must bleed back with ease. If the catheter is occluded or vein is blown, replace it with a new catheter into a different leg. Flush your catheter by attaching your saline flush to the T-connector's blue clave. Pull back on the plunger of the syringe until blood is noted in the line, confirming proper placement of the IV catheter. Then flush the line completely and clamp the line. We are now going to prepare the flush to be used during the chemotherapy drug administration. Locate the 10 cc flush syringe provided by VOP and remove the white cap. Attach the flush syringe to the EquiShield female lure lock connector and set aside. You are now ready to administer your patient's chemotherapy dose. Place the chemotherapy administration pad under the patient's limb. Attach the lure lock adapter provided to the blue clave port of the primed T-connector. Next, remove the red cap from the chemotherapy drug syringe and connect the EquiShield female lure lock connector to the EquiShield lure lock adapter that was previously attached to the patient's T-connector line. To connect the EquiShield components, line up the 3 vertical red lines on both adapters as seen in this image and press firmly together until the button clicks into place. Now that your chemotherapy syringe is attached, give the chemotherapy drug as a bolus slowly over about 20 seconds, watching the catheter site carefully for any sign of extravasation. Disconnect the empty chemotherapy syringe by pushing the round button shown here and firmly pulling apart the adapters. Now take your 10 cc flush syringe, remove the red cap, and connect to the lure lock adapter as previously described. Flush the T-connector and catheter completely with the 10 ml of saline. Disconnect the flush syringe. Finally, remove the IV catheter from the patient by cutting the tape on the lateral aspect of the limb away from the catheter and place on the chemotherapy administration pad. Put the used chemotherapy and flush syringes on the pad. Roll the entire chemotherapy pad, including patient catheter and all the chemotherapy supplies, and place inside the provided plastic chemotherapy transport bag. Seal completely. Dispose of the chemotherapy bag as well as your gloves and gowns into the yellow chemotherapy disposal bag or bin for your hospital.